Okay, on to our whirlwind tour this module to the next system, which is the vestibular system. We briefly talked about it in the vision system with regard to the vestibular ocular reflex. We're not going to go into detail on this, just like we haven't in any of the systems on this module. We'll talk briefly about vestibular anatomy. I want you to be able to list the primary functions of the vestibular system, describe briefly the difference between central and peripheral vestibular disorder symptoms, and to be able to describe the pathology, etiology, signs, and symptoms of BPPV, which is benign paroxysmal positional vertigo, Meniere's disease, vestibular neuritis, and perilimb fistula. We'll talk briefly about vestibular rehabilitation. Vestibular rehabilitation is not considered entry level for PTs or for PTAs, so we will briefly talk about it, but it's something that if you're interested in, you will need to get continuing ed. And I would suggest doing it after you've had a few years of good, solid clinical experience underneath your belt. So I went to a vestibular workshop recently, and I ran into two of my former students, so it was so much fun to see them in class. And so it's something that you might want to pursue later on in your career. Vestibular information is essential for postural control and control of eye movements. The vestibular apparatus contains sensory receptors that respond to the position of the head relative to gravity and to head movement. So it's, our vision is processing light into neural signals. The vestibular system is processing gravity into neural signals. So how's it going to do that? Let's find out. Information is converted into neural signals in a way that we'll talk about in a minute, and they're conveyed to the vestibular nerve by the vestibular nerve to the vestibular nuclei. Projections from the vestibular nuclei contribute to sensory information about head movement and the head position relative to gravity. Gaze stabilization, that is the control of eye movements when the head moves. Postural adjustments, and autonomic function and consciousness. So all important things. So the vestibular apparatus consists of bony and membranous labyrinths and what we call hair cells. They're not really hair, but that's just what they're called. Receptors inside the membranous labyrinth are hair cells. So the bending of the hair cells determines the frequency of signals conveyed by the vestibular nerve. So that's how they're affected by gravity. Gravity moves those hair cells to one side or the other, and it's really those are the sensory ends of the vestibular nerve axons, is those hair cells. So they're sensory receptor ends is what they really are. So the receptors in the semicircular canals detect movement of the head by sensing the motion of the fluid inside them, which is called endolymph. The semicircular canals are made up of 3 hollow rings arranged perpendicular to each other. So this is obviously a flat picture of that. In the module, there's video where you can see some 3D pictures of the vestibular apparatus. And so you can see how it detects gravity in 3 dimensions. Each of the rings is open at both ends into a chamber that's called the utricle. And each semicircular canal has two structures called an ampulla containing a crista. So the crista is a body of supporting cells and those sensory endings of the vestibular nerve, the hair cells. The hair cells are embedded in a gelatinous mass called the cupula. I am not going to quiz you on all the different little terms associated with the vestibular apparatus. Really, I'm just briefly going over the anatomy to acquaint you with the terms. Each canal in a pair produces reciprocal signals, so meaning left and right being the pair. So increased signals in the left canal occur simultaneously with decreased signals from the right canal. and vice versa. So reciprocal signals are essential for normal vestibular function. If the signals from a pair of semicircular canals are not reciprocal, then difficulties will result with the control of posture, abnormal eye movements, and nausea. Because we don't get that increase on one side and decrease on the other, we basically can't sense where we are in space. So the bilateral function is super important for the function of the vestibular system. So the utricle and the saccule are called otolithic organs. Otoliths, oto means ear and lith means rocks, so or stones. So otoliths are little pieces of calcium that are embedded in the vestibular apparatus. So the utricle and saccule are membranous sacs within the vestibular apparatus that are not sensitive to rotation, but they respond to head position relative to gravity and to linear acceleration and deceleration. Macula are hair cells that are enclosed by a gelatinous mass topped by calcium carbonate crystals. So those are the otoliths. They're located within the utricle and the saccule. Otoconia are the calcium carbonate crystals. They're more dense than the surrounding fluid and the gelatinous support. So when you have acceleration and deceleration, the rocks move, they bend the gelatin basically, and they bend those hair cells. When you change position, it tilts the macula, and the weight of the otoconia displaces the gelatinous mass, bending embedded hairs. So you can picture a block of jello with crystals on top of it, or with rocks on top of it, and if you tilted the plate so the jello went to one side, the rocks would pull the top of the jello more over to that side and bend the bottom of the jello. So bending the hair cells stimulates or inhibits the neural impulse depending on the direction of the bend, and that determines the frequency of firing of the neurons in the vestibular nerve. So if it bends one way, it is an inhibitory effect. If it bends the other way, it's an excitatory effect on the vestibular nerve. So you can see how if you it works in pairs from right to left. If you are bending, the hairs are bending to the right, it's stimulating it's exciting the right and inhibiting the left. If it's bending to the left, it's exciting the left and inhibiting the right. So that's how you get that paired action. The vestibular nerve transmits information from the semicircular canals and the otolithic organs to the vestibular nuclei in the medulla and pons and onto the cerebellum. So there's a part of the cerebellum, the vestibulocerebellum, which is dedicated to processing that information. So the peripheral part of the vestibular system consists of the vestibular apparatus and the peripheral part of the vestibular nerve. The central part is that vestibular cerebellum that is processing that information.